Dude, this suit is itchy, by the way. Is your suit itchy? Anyway, are we live?
Oh shit. Yeah.
Don't say shit. It's a clean.
Can't hear me.
It's a clean show.
I don't have a mic.
Cut to Z.
Well, hey, Z-Pack, are you here? Hold on. Let's see if anybody's actually anybody's live, because we're on Sunday and this is against. Oh, whoa! Wait a minute. Oh, that's us. Looks like we are live, but 670 people. You better just start the show, bro.
1, 2, 3.
Just give me patience, yeah.
What is up, Z-Pack? It is live and direct. It's Sunday, March 25th? We lose track of this stuff. But I gotta say, this is Against Medical Advice, our weekly insane live show, and we have a lot to talk about, okay? And here's something I gotta tell you guys. Did you notice our new intro? We shortened it a bit. And if you noticed very carefully, especially on the replay, listen to the beats of the EKG and you will hear an S3 gallop. That's right, people. Logan, hit me some reverb. Science! That's what we're all about, people. We're all about mixing science, fun, and kapow in a live show. I don't even know what kapow is. What do you think?
It's some sort of kung pao.
It's like kung pao, but with extra spicy sauce and also peanuts. You know what's interesting? Tom, I should introduce you guys. Tom Heineber, producer. Logan Stewart on the board.
You know how you can tell today's show is serious? Because we're wearing suits, people. Okay?
I have no idea what you're talking about, Tom Heineber. This is just standard issue wear for me. By the way, you know, people are always like, I get these messages all the time, Tom. People saying, are you a real doctor? In Facebook private messages. And I'm like, are you someone who can use Google? Because if you can use Google, and I know that you do because you're a patient and you probably use the Dr. Google second opinion, you can find out that, in fact, I'm a doctor. But today I decided, let's look professional for a change. I mean, what do you think?
Maybe we should play a clip from the show where we're not professional that we just started this week.
Yeah, so hang on. I got to tell you guys, we started a show this week called Incident Report. It's a daily version of this show that's a lot more casual and a lot of fun and incredibly interactive every day, 4 p.m. Pacific, 7 Eastern. And why don't we just roll some of the last week's episode?
Go, 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 go. I'm
I'm not.
I love Scrooge McDuck.
I do too. He's amazing.
Life
is like a hurricane here in Duckburg.
Turmeric, and a lot of people take it as a daily health supplement. It was injected directly into her veins.
Don't make me do it, Tom Heineber.
Don't do it, Z. You have too much to live for.
Don't make me do it.
Don't do it!
I don't want to live forever, bro.
You're not supposed to make me cry on the show. So, like, if you're going to do that, don't do it on the show.
Race cars, lasers, airplanes, it's a duck blur.
Might solve a mystery, or rewrite history.
Chlorophyll,
No.
turmeric for the cancer-fighting inflammation.
DuckTales! Woo! Boop, 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 boop. Every day we're out there making DuckTales. There's a stranger out to find you. There's some danger right behind you. What to do? Just grab onto some DuckTales. Woo!
By the way, somebody says they'd buy a car from you. You do look like a used car salesman.
I kind of feel.
Did you used to dress like this every day on the wards?
So wait a minute. You saying I look like a used car salesman, aka Dr. Oz?
Oh snap! You got burnt, son.
Every
You
episode,
burnt.
people, you can count on it like clockwork. I will diss the great Oz.
Is this what you used to dress like when you would round?
When I would round at the hospital daily, I would wear this without the coat because the coat would be covered very rapidly in MRSA, CRE, various enterococci, fungus, and bed bugs, not to mention scabies.
So let's get into the subject at hand. Let's talk about Obamacare.
Yeah.
All right?
Yeah.
And you were reading an article from the LA Times, I think it were.
Well, I mean, it's interesting because
Logan, you want to put this up and we'll...
Failure of their health care bill leaves Republicans running Obamacare. That could open the way for bipartisan changes. Oh, I'm sorry, you mean the bipartisan changes that should have happened at the very beginning of this debacle when the thing passed with not a single bipartisan vote, right? So now we're in this position where, by the way, I mean, you don't have the votes.
You don't have the votes. Ha 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 ha. You're gonna need congressional approval and you don't have the votes.
What a blunder. Sometimes I even wonder why I even bring the thunder.
Why he even bring the thunder?
Hamilton pretty much has an answer for pretty much every situation in life these days. Am I right? I mean, come on. Come on, people.
Only like 6 people like that Hamilton thing. Also, we're not making fun of the Republicans, but I do think it's lame that they went down in flames like that.
Well, they kind of gave up because they said, you know what? This is basically, they realized this is the new Coke of healthcare proposals. It's like we took Coke, which some people already loved and some people hated, and they said, oh, let's just make it better by making it 2.0 Coke. A little sweeter, a little sourer here, a little bit different can, and then put it out, and then people looked at it and they're like, yeah, all this does is makes Obamacare worse. If you're going to fix Obamacare, either fix Obamacare, repeal it entirely and start from scratch. But I think people realize, don't do this like blah. Like nobody liked that bill, except for Paul Ryan, who likes PowerPoint, which is never okay.
Well, it's kind of interesting because the Republicans it passed without a single Republican vote the first time around. So, I mean, I guess this is just, they can finally get some say on Obamacare now, is what's happening?
I think what's happening is now, I think as the article says, and let me pull it up. This article is written by a friend of mine, Noam Levy, who writes for the LA Times, which is fake news apparently, according to some. What he's saying is now with the failure of the American Health Care Act, what's happening is both parties are going to have to own health care really for the first time, because Obamacare continues on the watch of Republicans, which means if they let it implode, they're responsible. If they fix it, they can look really good. If both parties come together and fix it, then the country could do good, right? But heaven forbid that the country does good, right, Tom? I mean, that's not really ever been in the cards.
No, the most important thing is that we, congressmen, because I'm in a suit now, we keep our jobs. That's what's most important to me.
I think Laura Tobias said, just because you guys wear suits doesn't make it professional. I beg to differ.
It's very true.
Let's read a couple here. Paul Ryan has no soul, Janie Garner. Now, Janie, that is a partisan comment. And we don't do partisan comments here at Against Medical Advice. Or do we, Tom? Do you want to make a partisan comment?
I'll make a partisan comment. Yeah. I don't like Obamacare, and I wish it was gone forever, but I guess it just can't die.
How do you currently have insurance?
Through my wife, who's a nurse.
You don't have the votes.
Listen, people, do what I say, not as I do, okay?
Yeah,
that's what I'm saying.
Well, it's interesting because like Logan is currently on insurance from his parents, and he's 25. So you would not have been able to do that pre-Obamacare. However, I, as a small business owner, ZDogg MD LLC, am paying sky-high premiums because I don't get federal subsidies, and I'm compelled to get insurance. Of course, I would anyways because my family needs not to die on the street.
What do you think about this Cadillac healthcare thing? This tax on Cadillac-ish program.
Yeah, so one of the provisions of the Affordable Care Act in the beginning was, and it's an inordinately complex act, right? 2,000 odd pages. Nobody understood it until it went live, and everyone was like, oh my God. So the Cadillac tax, which is really scheduled to go live, I think in 2020, was a way to say, okay, really fancy insurance provided by insurers is going to be taxed at a 40% marginal rate above a certain threshold, and that's going to fund the expansion of the ACA, and it's going to discourage sort of overspending, because those Cadillac plans really encourage patients to go and just go crazy, get whatever kind of specialty care they want, even if it's not needed, right? Because often less is more.
Yeah, but isn't that if you give them better health care, won't that have a net positive effect on Medicare and Medicaid?
You give them more health care, so you're saying you keep them healthier so when they're old, they're not a drain on the system?
Yes.
Yeah, the problem is,
exactly what I'm saying.
This is the thing, Tom. More in healthcare does not mean better. More expensive does not mean better. The best care is usually the highest value, meaning people who are optimized to do colonoscopies don't need to charge a whole lot, especially if they were charging cash. And the problem with the whole insurance system is that it artificially inflates costs, and those costs don't correlate to actual value.
Well, okay, but and then how we fund everything, right? Like, what are your thoughts on this HSA thing?
So HSAs, health savings accounts. This is an interesting.
And wait, what's the difference between an HRA and an HSA? Because I don't think I know.
Actually, the last time we talked vaguely about this, a lot of Z-Packers got confused. HRAs, health reimbursement accounts, are offered by employers. You put money in and you can use it for healthcare expenses, but if you don't use it that year, it goes poof. So it's a use it or lose it, which to me encourages spending, right? Whereas a health savings account means you put money away pre-tax, meaning you don't have to pay tax on it. It's a sort of a tax preferred account. And it can grow year over year, and you can take it out to use for qualified medical events. So when you're older, if you have a big health savings account, this is the theory, you can use it to spend for your health costs. The problem is the health costs exceed the amount you can put away by an order of magnitude. And I think, Lord Vader had some thoughts on this, didn't he?
I do have a Vader clip talking about
I think we asked
HSAs.
Doc Vader, we're like, what do you think of health savings accounts?
Let's roll that clip, Logan.
Let's roll that.
Health savings accounts. It is one thing to be an informed consumer and make capitalistic decisions. Even the emperor approves of such behavior. However, how will you do it without knowing the price? What if you walked into a galactic McDonald's and said, I would like to order, and the person behind the counter said, here is your Big Mac with extra cheese and a large fries, supersized. And you're like, I didn't really want, this is what you will have. Well, how much will it cost? You shall see. And then 14 weeks later, you get an itemized bill per French fry and grain of salt for 20,000 imperial credits. It's like when I go into Red Lobster and I'm like, I want to order, and she's like, you're having the crab's legs. And I'm like, but I don't want you're having the crab's legs. Well, what do they cost? I don't really want oh, they're market price. What does that mean? How much? Oh, you'll see. What kind of bullshit is that? I don't have time for market price. I want my biscuits, right? Those biscuits, though. And I want the scampies, because scampies is plural for shrimp. I want those things, and I want to know what they cost before I pay for them. But no, everything in healthcare is market price. MP, and then I'm broke, bitch. I ain't got time for that. My patients don't have time for that. Health savings accounts. Good luck with that. Whatever. You know what? I hated Obamacare. It was dark side, but it's better than this ish. I'm going to Canada.
Vader for POTUS, says Amanda Bernheisel.
Vader for POTUS, he'd be like,
And my only plank? Those biscuits, though, in every basket. Across this land, everyone shall have a Red Lobster cheddar cheese biscuit.
So, dude, are we stuck with Obamacare for the foreseeable future?
well, I think for those who hate it, it would be a stuck. For those who love it, they think it's a bridge, really, to a more egalitarian single parent.
Who loves Obamacare?
A lot of people love Obamacare.
Who?
Well, let me explain the people who would love Obamacare. Federally qualified health centers who, through the expansion of Medicaid, are now able to actually get paid to take care of our poorest, most vulnerable patients. People like, I don't know, Turntable Health at our prime. We were partnered with one of the big artifices of the Affordable Care Act, which are the health cooperative insurance companies that were created to form kind of competition and lower prices in the market on the exchanges. We partnered with one of them and they said, you know what, the idea is prevention. We're going to pay you to keep people healthy, which was unheard of. Accountable care organizations sprung up under Obamacare. Now the thing is, they only save maybe 1% or 2%, but that's better than increasing prices. So it was a start. I actually think, this is my opinion, it was a start. It is nowhere near what we need to do. And if you disagree with entitlements, then we have to figure out a way to make it work for everybody without creating a massive entitlement program, which some will complain that it is.
Let me just ask you a basic philosophical question. Is healthcare a right or a privilege?
This is interesting. The part of me that went to Berkeley as an undergrad says healthcare is a human right. The part of me that studied for so many years to be a doctor and then gets treated like crap by patients who come with a very entitled attitude and don't take care of themselves and don't do their part says, hell no, you need to do your part. So I think the answer is somewhere in between.
That sounds like a non-answer, Z.
That's because it is, Tom Heineberg. What's your answer?
It's not a right. It's a privilege.
It's a
Some
privilege.
people have to die, honestly.
But who's going to pay the price if they're dying? It's society in the end, right?
Is that accurate?
I think it is, because in this country, if you're uninsured, which you would have been if the Affordable Care Act wasn't there, Logan would be uninsured right now. What would happen is he would go to a county hospital. I love picking on Logan. He's like, no, I wouldn't. I have money. Like, you don't have money. Maybe he has money. I don't know. I'm not Logan's keeper, all right? He's adorable. That's all I know. So in those situations, people go to the county hospitals, and actually one of the biggest proponents now of not having the American Health Care Act pass, in other words, this Obamacare tweak, is new Coke of healthcare, is the America's Essential Hospitals, which is an organization that represents America's safety net hospitals. I've actually, full disclosure, I've spoken for them before. I've done a talk for them. And these are people who are running like the county hospitals and the hospitals that are taking care of these patients that don't have insurance. We don't let them die. We take care of them at great expense. How about we actually give them insurance, prevent the disease before they're sick, hold them accountable. We haven't done that yet. Hold them accountable for their care, but give them the tools, be their shepherd. That's what we tried to do at Turntable, man.
So you're saying you want to give everybody free stuff and then hold them accountable and be their shepherd?
No, I'm saying give people a mechanism through which accountability actually makes sense. If you're born into abject poverty and you're a single mom, you're taking care of your kids and all that, there's not a lot of mechanisms for you to be accountable for your health care. You can't afford to shop at Whole Foods, and you wouldn't want to anyways because, I mean, I don't go there. Come on.
Let me give you a scenario, okay, for accountability. I am a non-tax-paying citizen. I fall below the poverty line. I don't sign up for any of the healthcare options that are available to me, and then I get taken care of anyway when I go to County General or wherever. Where's the accountability for me?
No, that's the problem. Because we don't have a system. Look, imagine we had a Medicare for all. I'm just theorizing, okay, a single-payer system that said patients have to accomplish certain things before they will get covered or before they'll get full reimbursement for their medical costs. Well, then they would be forced to do it. So you have to bake in something that does hold people accountable. The truth is, we as caregivers aren't incentivized to hold patients accountable because right now there's no driver of that. If we're working on a preventative medicine team-based system that focuses 3.0 basically on not only provider accountability but patient accountability, then we can actually do it, but it's not going to happen overnight, and it's not going to be politicians who drive it. It's going to be the practitioners of the dark arts of healthcare that drive it. That's the problem. We've been voiceless in this whole thing. Who wrote this bill? Who wrote the American Health Care Act? Like Tom Price hasn't seen a patient in God knows how many years, right? It'd be like asking Dr. Oz to write healthcare legislation. It's crazy. He and Oprah would sit down and Ellen would come by with a bong. They'd all get high and they'd be like, how about this, bro? And it would be basically probably what we have now. Maybe better.
It'd be just exactly what we have.
Maybe that's what we need. You know what I'm saying? Well, let me see what I have here. What else were we talking about? We should go through some comments.
Let's just go straight into overtime.
Yeah, let's go into overtime.
Play
Logan.
the overtime clip,
Roll that
Logan. Let's
clip.
talk to the people. And we're back,
right.
Dizzle. Do you see any comments that you like?
The problem with healthcare being a right is that those who don't have insurance die, have those who are dependent on them, children, elderly parents, et cetera, disabled children, Maria Fisher. So what do you think of that, Tom? Like the idea that if healthcare isn't a right, what about the kids who have no ability to make it a privilege, right?
So maybe you're saying it's a right for children or adolescents?
And the question is where do you draw the line at accountability and personal agency to say, well, a child can't make the decision to be healthy, so, or this poor woman who has through no choice of her own, got lupus and now is going to be bankrupt and destroyed by it. Like, is that okay in an advanced society? This is a
personally, I feel that if you can't afford health care for your child should be taken away from you. Same as if you can't afford a school lunch for your child. We shouldn't be giving school lunches to your children. If you can't feed your child, you have no business having a child.
That's interesting. That's an interesting comment. We'll see what people say. Wendell Lynn, as a single parent of 2 kids, I keep myself healthy so I don't end up in the hospital, and I do the same for my children, and I am not on Obamacare. So there's somebody who would fit the mold of behaving the way that you would want them to behave, right, Tom?
Yeah.
Trying to stay healthy. I mean, I've seen enough patients that I know that this is not a realistic expectation. I think we don't hold people accountable. That's a problem, and I think in healthcare we feel it as caregivers, but that draconian level of Darwinian accountability is not going to fly.
So if we're holding people accountable for their health, are we taxing them?
Well, we have to tax everybody in order to do that.
Are we taxing them on specific health measures?
Oh, so what do you mean? Like
sin taxes and all this
like
kind of stuff.
sin tax.
Yeah, if you're a certain weight, if
Right.
your BMI is too much, you're getting taxed.
Are you fat shaming me, bro?
I think I am.
Because I think you're fat shaming me.
I think I am.
Well, here's an interesting question, Tom.
Actually, you look good in that suit, Z. Like I'm just saying, bro.
Wow, 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 wow. I've been trying to learn how to tie a tie again. Well, actually, what you bring up is an interesting point because this idea, I think we're way too politically correct. Look, Z-Pack, you know me well enough to know that I don't hew to any particular political ideology. I hate butthurt. I hate political correctness. At the same time, I do think that we should provide equitable health care but hold people accountable. So here's the thing. In a sin tax, what you're doing is you're saying, I'm going to penalize people for smoking, for bad behavior, et cetera. I'm actually of the opinion that a lot of that behavior is conditioned by our available society and stuff, and we should hold people accountable. We should tweak society so that the elephant walks on the right path, but I think a pure sin tax would fail.
Amy Anderson says, what about people that lose their job and need temporary help, Tom? I have a plan to fix welfare, people.
He's wearing a suit, so he is a politician.
Listen to me. I know how to fix welfare. What we're going to do is you get 2 years worth of $2,000 a month payments to use at any point during your life. You use them up, it's on you.
That is a fascinating plan. I'd love to see the bipartisan support that one gets, Tom Heineberg. So TLI has something interesting here. HCAP scores have to go before we can tell people no and make them accountable. What an interesting, so HCAP's these hospital satisfaction surveys, et cetera, right? Health consumer, whatever the hell it stands for. I don't care because I hate them, and so does Doc Vader. The question is, can we even tell patients, look, you're overweight, you need to change, you need to stop smoking crack, you need to take care of your kids, you need to stop beating your wife, all these things. Can we even say those things without getting dinged on our satisfaction surveys and thereby affecting the income of ourselves and our hospitals? The answer currently is no. So how can we possibly hold patients accountable when we're held to an accountability that makes no sense?
That's the whole problem, right?
Yeah.
That's what we always talk about.
Yeah, we talk about it constantly.
Yeah.
Anytime Vader does a clip on patient satisfaction, it goes viral. Why is that? Like, this is a little inside the actor studio because we talk about this stuff like, well, why did this clip go viral and this one didn't? Well, because this is hitting a pain point that all of us on the front lines care about. And patient satisfaction is a major pain point. And one of the things that comes out of these sort of parodies is that I'm often bashing administrators because they're easy targets because you always punch up when you're doing comedy. But the truth is I've met a lot of administrators who hate this stuff as much as we do and they want to do the right thing for patients. So we have to work with those administrators to try to build this 3.0 health system that, guys, here's another thing. Look at the title. Can you play that title clip again of the article? Look at this article. Failure of their health care bill leaves Republicans running Obamacare. That could open the way for bipartisan changes. Is this an opportunity, Tom, to actually have our voice heard, for me and Tom to go to Washington and do a show with the Donald and be like, look, we need to do something better?
Well, I would love for people to sit down and talk to us or anyone on the front lines of healthcare and actually ask them what they think. Because listen, I'm saying a bunch of ridiculous nonsense because I don't have any skin in the game, you know? It should be up to the frontline healthcare providers to tell us where we're going, what we're doing.
This is an interesting comment. Crystal Keen, God doesn't always give you children when you're financially stable. Atheists like me say God doesn't always give you children, but that's another, no, I'm kidding. As a Canadian, my ears hurt, ZDogg MD. Where's the compassion? No insurance for kids, Zachariah Razmi. So Zachariah, here's the thing. When I go to Europe and I talk there, people look at us in America like we are alien, vicious criminals. And it's interesting because, again, here's a theory, Tom Heineberg. And Democrats, oh, did you? Oh,
hit
dude,
me.
cover that Coke before it ends up on my computer.
I'll just drink it. Chug it. Go back to Z.
I don't trust Tom Heineberg at all. There's a lot of theories, and I can actually confirm this because I've talked with some high-up Democrats. The way that they see the world is that they're very smart, and they understand where society needs to go, and they are going to lead it by throwing legislation out that leads it. I think Affordable Care Act was one of those things, right? So they think that society will just catch up, and they look at Europe and they say, see, the Europeans see this healthcare as a right, the Canadians see healthcare as a right, and et cetera, et cetera, et cetera. What do you think of this, Tom?
Like I've said, I don't think it's a right. And I think you know, we have a big problem. There's 330 million people in America. That's a lot of people. And in order for us to have entitlement programs, we have to make other nations indebted, destroy other cultures. We need to get our money from somewhere.
But what do you think? What do you think of Democrats thinking that they know where society ought to go?
I think that the Democratic Party wants to keep everyone poor, is my own personal belief. I think they have some sort of system where everybody gets their basic needs met, but we all sort of wander around listless like some Orwellian novel, and no one really ever gets ahead. But that's just me, you guys.
You know, suddenly we're InfoWars with Tom Heineberg. I love it. Well,
Z was like, go ahead and embrace your conservative side today, Tom. I was like, no problem, Z.
yeah, I love it. I love it. This is what I love. It's a dialogue. So I'll tell you what I think, because I've talked to these people. I don't think, and they in their moments of guard being down, they will tell you exactly what they think. They actually think that we should take care of each other as a society, and it's part of a covenant that we have, and that holding each other accountable to take care of each other is an important piece of this, and that they're trying to set an example so that the society will push forward. But you had a different opinion on that, right, Tom? We were talking earlier about what you think. Like you don't think that people are going to catch up with that way of thinking.
They're never going to catch up with it. You have to give people a chance to do their best in America. It's pursuit of happiness, not guaranteed happiness.
But what about this idea that, you know, we used to have slavery, we used to have a lot of horrible stuff for women, we used to have et cetera, sweatshops for kids. That's all gone away. Don't you think healthcare as a right is a natural expression of the evolution of society?
This is the fundamental problem of capitalism, is that capitalism unchecked always ends in slavery. So you have to have a government body regulating it. I'm not like a full-on libertarian that says let's get rid of the state and just do everything on the free markets basis. That's never going to work. So I don't know, is healthcare an extension? Is it a right? Can't we make it cheaper? Why is it so expensive?
So that's...
If it was cheaper, I'd be fine with it being a right. But it's so expensive, it's going to literally sink the country.
I didn't even feed you that line, and that's exactly my feeling. And the way you make healthcare more affordable, I don't like the term cheap because it feels like we're in a Kmart, and I don't like healthcare and Kmart intersecting, although it may be dope, like a blue light special on like wart removal. But the way I see it is, if we improve the care model, so actual effective care that's value-based, meaning we are optimized, we know what we're doing, we're evidence-based, but we also spend time with the patients and understand their unique story and harvest the power of placebo without lying to patients and using magical thinking. So we can think holistically, we can use the stuff in the alternative medicine pantheon, but not lie to patients about magical chi powers. If we do all of that, we can constrict the costs, improve the happiness of the care delivery people. I sound like a pizza guy.
You do.
And improve costs so that then it doesn't matter. We can afford it as a society to pay for it. That's my ultimate secret mission.
By the way, everyone's going super hard on me in the comments because I'm drinking a Coke and talking shit on the poor. I don't think we should have sin taxes, and I think part of the beauty of being an American is I can down this, go eat a McFlurry, go smoke a bowl, do whatever I feel like, and you can't tell me not to. So...
Let's read one more, or a few more comments here, because I think this is a good discussion. We should just continue it. What do you guys think, Zipak? Dawn Pelej, can we please talk about how by the way, on the podcast rerun of this, you guys can fast forward to this point if you don't like this amazing discussion, but we're going to talk when we think talking is appropriate. Dawn Pelej says, can we please talk about how red state governors didn't find the ACA appropriate, and that some people love the ACA and others hate it? People love and hate really have a ton to do with how the expansion was funded in their state. So this idea, Dawn is pointing out that some states, 19 states, did not fund Medicaid expansion and left federal dollars on the table, presumably based on ideological reasons. Now, Tom, if the federal government says, I'll give your state a bunch of money to take care of your poor, and you said, I'm not going to do it because I think poor people should die, is that...
I would never say that. I would never say that.
Is that okay, or do you think that governor was behaving not in the fiduciary interests of his state?
The money's coming from the federal government.
From the federal
in this
government.
scenario?
It's our money. In other words, it's the state's money.
People love to say this. It's our money. No, it was forcibly taken from us. It's not. They giving it back to you is, neither here nor there. There's an interesting comment. Kelly Bell says healthcare won't sink the country. 2% of everyone's tax is enough to cover healthcare. But this is a slippery slope to me because you keep saying that 2%. It's just 2%. It's just 1%. It's just 4%.
Tom, we're all equal.
And then we're at 100% tax.
Some are more equal.
And we just have straight up communism. And I put a bullet in my head.
But you see, has that happened in Europe? Has that happened in Europe?
It's happening in Europe right now.
Do you think so? I mean, you 100%. Think the populism that's happening in Europe is a response to healthcare?
Not to healthcare. I'm just saying this is part of a broader scope of everything. It's not like healthcare is the iceberg. It's the iceberg that puts the little ding in the side.
Right.
Right. Now we got a hole in the boat.
Right. By the way, I also think it's funny since we were talking about this earlier. We're like, well, how are we going to distinguish our Sunday show from our daily incident report? And we're like, well, we're not going to curse, and we're going to wear suits. And the first thing Tom did and Logan did were curse. And I'm going to put Tom's suit in quotes because it looks like his prom suit from high school that he dug out. Was that from your wedding?
Listen, this is my only suit, and my BMI is a little high. Okay, so don't tax me, Big Daddy government. Having a hard time fitting in this suit a little bit.
You don't have the coat. You don't have the coat. Let's read some comments. Is Tom in healthcare or just a millennial?
Just a millennial, people.
Guys, but you have to understand, Tom, the reason Tom is on the show, number one, he's the producer. Number two, you guys don't understand, I think you do understand, that he is smart beyond his years. Three, as a millennial, he has as much right and more to be at the table because millennials are going to become indentured servants to this broken healthcare system if we don't fix it. And if they don't have a voice, right? And part of the sensibility of this show is appealing to younger people. We want them to take up the arms of Health 3.0. Because if we fix the care model, we can fix the payment model, right? But it has to go hand in hand.
And do you feel that when you go out and talk to the young medical students, do you feel that the tide is turning on this?
Oh my gosh, dude. These medical students, when I speak at medical schools and residency programs, they are desperate for change. They are ready to man the battlements of Health 3.0. They cannot wait, and that is one of the most encouraging things that I see. The danger is that it's all going to be beaten out of them by this this broken system. And if we don't stand up together with our next generation, and there's a saying, right, medicine changes one funeral or one retirement at a time, and it's brutal, but it's true. It's time that this wave of young people kind of stood up and said, no, this is not going to stand. We need better, more compassionate care, and then we can worry about how to pay for it. But the main thing is, can we even deliver it right? Right now we can't. That's the big deal.
Well, and do you think they like a single-payer system? Do you think they like this government interference? And they're willing to work for it because they're the ones who have the piles of student debt.
Yeah. Well, I'll say this. They're a lot more, the sense I get is they're more progressive on those sort of issues. That's why Bernie was so popular among very young people. But there are still a lot of very conservative young people who would push back on that. But I think, look, this idea that society does have a particular trajectory of progress is one I think both parties share, right? Conservatives want to make sure that as we advance, we hold on to those moral issues and those institutions and those ways of thinking that made us who we are. And I think progressives feel like, and Democrats feel like, torpedoes full steam ahead, we need progress. And I think the truth is probably somewhere in between, and this is just my 2 cents. I don't know. I'm just a dude in a suit on a Sunday show, which y'all are watching. 704 people are watching, right?
Let's take some more comments. Man.
Yeah. What do we got? I make too much money for subsidies, says Michelle Solis-Williams, to help me get insurance, and I don't make enough to buy this insurance. But I get penalized every year when I pay my taxes to pay for everyone else to get Obamacare. A lot of us fall in this category. I would love to have insurance that doesn't cost me $500 a month and have a $6,000 deductible, which I will never use. Even something got hurt. Even if I got hurt, where would I get that $6,000? Michelle, I'm so glad you asked that question. First of all, Tom, your thoughts, and I'm going to tell you mine.
No.
Or maybe I'll just tell you mine.
People are mad at me in the comments, see, so.
That's fantastic. Guys, let me tell you something. Tom takes your madness very personally. He says he doesn't, but he's actually butthurt by it. So keep it coming. Keep it coming. Torture him. You guys have to understand, Tom is an amazing guy. I wouldn't let him on the show if he wasn't fantastic. And actually, his beliefs have a lot of validity, especially when parsed through our current debate. And that's why he's here, because he is bringing an important voice. And he's a total a-hole. Total.
Yeah, totally.
No, he's actually not. So here's the thing. By the way, you guys want to know the type of person Tom Heineber is? And this is a little confessional moment. You know the video 7 Years. If you haven't seen it, watch 7 Years. That was his idea. That was his direction. It was his sequence. It was his way of constructing that emotional apex in that song. Like, this guy will lie to you and tell you he doesn't care about people, but deep inside, he's got a soft, liberal nougat that's just waiting to ooze out of his pores like blood out of an Ebola victim.
The thing is, I've been hurt. I've been hurt before. I don't want to be hurt again. Okay?
I'm sorry. I was crying, not laughing. So Michelle, to answer your question, even under Affordable Care Act, she is forced to get insurance through the individual mandate, and if she doesn't, she gets a tax penalty. Conservatives hate this. A lot of people hate this. It feels unfair. Second thing is, even if she gets insurance, it's expensive, and then it has a $6,500 deductible for families, right? That's unaffordable for people, so where's the affordable in the Affordable Care Act? Third, what the heck is a health savings account, right? If you don't have the ability to actually know what prices are, to be an educated consumer. And high deductible plans has kind of been shown what people do instead of being smart with their money and not wasting the deductible. They just avoid all care, including important care, life-saving care, and preventative care. So high deductible plans, although showing early promise, have not panned out as something that works. So when we think about how to do this, we have to fix this. It's simple as that.
Yeah, I mean, if you have a $5,000 deductible, for a lot of families, that's really the same as not having health insurance.
It's really the same.
Right.
You're effectively uninsured. You know what we used to call as underinsured. Like the uninsured and the underinsured.
Have you seen the article that says that I think it was like 70% of Americans don't have access to $400 cash in the event of an emergency?
Yeah, I saw that. And like something like 70% of people don't have any more than $14,000 for retirement or something.
Oh, it's sad. I
Yeah.
mean, if you ever listen to like Dave Ramsey's show, these little old grandmas call up all the time and go, "I'm 79, Dave, and I got $8,000 plus my Camry. What should I do, Dave?"
I'm like, first of all, Camry is the dopest ride on the planet. I know because I have a 2012 Camry. Next, this is a huge problem. And remember, when the healthcare costs start kicking in, and I've heard some people say, oh, they don't like Medicare and so on, but without it, these folks are basically in debtor's prison or dead the minute they get a gallbladder or end up with their first myocardial infarction from eating McDonald's because it's the only thing they could afford all their lives, and they're a single mom and so on and so forth. Or they live in Mississippi in the stroke belt.
You got to feel for these people. Okay, I'm going to have empathy for a second. You have to feel for them. But also, you know, there's a part of you that wants to shame them so that future generations don't do this behavior. And I don't know why we've been so quick to get rid of shame in our society. It's a powerful motivator.
You know, I think I'm not going to argue with us on this because I think we have taken away accountability. And I'm not talking about like ridiculing someone or something, but I think feeling some public responsibility for your behavior. Did you see the clip about the obese woman who was eating the ice cream cone and got yelled at by those boys?
I did, and I think we should talk about
Let's
it
talk
on
another show.
On another show.
Yeah.
But you know, I had a lot of empathy for her because she was saying, if you haven't seen the clip, there's a woman who went live on Facebook and she was saying that she was eating an ice cream cone at Dairy Queen and a bunch of guys drove by and yelled at her. And she was saying, you don't know me because I'm already 120 pounds into my weight loss journey, right? So this is just one treat for me to keep myself on the road, going forward, bettering myself. And what if what you had said was the last straw for me and it made me kill myself?
Yeah.
So I think it's a moderate, like we need to have moderate expectations of how much shame we should put on people. But shame is important. It keeps families together. This whole like, don't judge me, man. You can't judge me. Don't shame me. I don't believe in that at all. I mean, I don't know. What do you think?
No, I mean, I think just asking the question is verboten in today's politically correct society. Like in a society where like Milo Yiannopoulos can't even speak, and he's like, you know, violence. Like that's crazy to me. Like if we can't even have the conversation, I think it's worth talking about. So
I get it bad because it's like, oh, you're white male. Look at you.
Right.
Blah blah blah.
Right.
It's like, okay, great, but I shame myself all the time.
No, it's true.
You know.
Nobody has more self-shame than Tom Heinever. There's a great comment here, Liz Mangieri. Logan is giving very sage advice. He's sitting here, he's already like figured out cold fusion, and he's basically funded Medicare. He's funded Social Security, by probably in his mind, probably by destroying it entirely and replacing it with slave labor, which, yeah, exactly. So what do we got here? We're at 38 minutes. Let's go 2 more minutes and answer some comments.
Yeah, let's do it. Sharon Clark says, judge not lest ye be judged.
Well, this is it's not the golden rule, but it's an important rule.
Definitely not the golden rule. I don't know if Z's ever read the Bible, people.
I have. I actually read.
Have you?
I read both Old Testament and New Testament in college for a Western Civ class, and it apart from, well, I had a lot of thoughts, but it is really interesting. It's a series of fascinating case studies, really, that make you think about human nature and all of that. But the golden rule of do unto others as you would have them to do unto you is actually truly a golden rule in human society because it has to do with accountability, reciprocity. When you give someone a debt, you get paid back when you do a nice thing for someone, right? And so this is something that actually I think when you talk about accountability, keeping track of those things and publicly shaming people who don't live up to their end of the bargain, is that a bad thing? You know?
The golden rule is basically just a principle of empathy, right? Because you can technically do harm to people and feel fine about it if you're a psychopath. But if you have empathy, you're going to hurt yourself in doing that.
So why do we have empathy then evolutionarily?
So that we don't destroy the species, so we all band together.
Yeah.
I mean, a bunch of monkeys in a row, not that we're all monkeys or we came from monkeys, but
Well,
we did.
Logan mostly.
You know.
Yeah.
And, I mean, like, you can point out you have a bigger structure. You know, I heard this interesting, like when coyotes do their house, that's like a roll call to see which coyotes are still there. And if they don't hear a coyote, they will start breeding more,
Wow.
right?
Well, and I think you're spot on, because what the human cortex evolved as a way to keep scores in society, to keep track of social relationships. We can remember around 140 to 160 tribes people in a pack. We can remember the scores that we've got with them, remember their kids, their parents, that kind of thing. And that's crucial for functioning in a hypersocial environment like humans do. So when we think about who we are as a species, then we can extrapolate that to what should our healthcare system look like? What should our society look like? What should our science be looking at? I mean, I think it's all interrelated with human psychology.
isn't that the whole thing, is like what got us here that we need to keep, and then what do we need to strip away to get us there, right?
I think that's a fantastic way to wrap up the show, because that's spot on, and I agree 100%. So on that note, guys, here are my call to actions. I want you to share Against Medical Advice. I want you to tune in every day at 4 p.m. Pacific, 7 Eastern for Incident Rapport with Z-Dog MD, Logan Stewart, and Tom Heineber. We are going to keep growing this show. We have sponsors lined up. Things are getting crazy. If you know people who want to sponsor the show, hit us up. The other thing I want you to do is, after this live is over, there's an ability to subscribe to it in Facebook. Click that button. It will be hosted on my website, zdogmd.com. And we will have it on YouTube shortly, and as a podcast. The podcast is on iTunes. It's called Incident Report, and it's the audio version, so you can listen during your commute, share with your friends. Please, I will put the link in the comments to this. Go to iTunes, leave a review. 19 of you have already given us 5-star reviews, and we're ecstatic. Leave a written review, and that will bump us to the top of iTunes Science and Medicine category, and we will stick it to Sam Harris, who, by the way, when it says related podcast, Sam Harris comes up, and he's one of my idols. I was like, oh my God! Oh my God! So I'm super excited, guys, and I think it's time. What, anything else to say, Tom?
We're definitely not wearing suits tomorrow because these things are itchy, so.
And have a great Sunday. We out.
1, 2, 3.
Just give me that.